Ladies, I wanted to show you this. I've done a video on reasons why people, ladies, women go through multiple failed IVF cycles. I've done two extensive videos on my YouTube channel about the different causes of IVF failures. And and one of those videos is about the rare causes of why IVF cycles fail. Okay, you've had multiple failed IVF cycles. What do you do now? If you go for another one, what should you be looking out for? And I wanted to show you this. One of the things I talk about on the video about the solution basically is going for a fertility clinic that allows you to have a trial run, so a test run, so like almost going for a mock exam. And the benefit of going for a mock trial, so to speak, is so that they can anticipate some of the things that can go wrong during embryo transfer, particularly if you are a woman who has suffered so much trauma from having failed cycles over and over again. One of the reasons why your IVF cycle may fail, this right here, the entrance of your womb is the cervix. There is a condition called cervical stenosis. In that condition, the entrance to your cervix here at the cervical os, literally that small hole here, is completely closed. So you can imagine if you go for your IVF cycle, even if it's going to be your first one, be armed with this information. If you go for a cycle and your cervical os really right here at the center is completely closed, they're ready with the embryo, they're ready to insert, but they don't know that your cervical os is closed. Why? Half of the time it's because you've not come across a fertility specialist who's done his or her due diligence to use a uterine sound to insert through the cervical os to make sure that your cervical os is still open. So you can imagine on the day when you're ready for the transfer of the embryo, they try to go in and the cervical os is closed because you have a condition called cervical stenosis. So ladies, those of you especially who have had multiple failed cycle, who have decided to go for a different fertility specialist or even stick to the same one, have that discussion with them. How can we make sure that everything is okay before we go for the next cycle? For example, can I have a mock trial? And during that mock trial, if they've not already done so, a uterine sound should be used to insert through your cervical os to make sure that things are going through easily. Another thing that could cause a failed IVF cycle is having one of these right here. That is a polyp. That's a uterine polyp. So as the catheter, which contains the embryo, gets inserted, so for you, for example, your cervical os is fine, it gets inserted, and as they get through the middle of the uterine cavity, they cannot advance because you have one of these. That's a cervical polyp. If you go for a test run, they will find this out. They will find out that you've got a polyp, and a polyp is very easy to remove. All that has to happen, the fertility specialist, the gynecologist will nip it away, and that's it. And that is something that can be found when you have a trial run. Another thing which I really would expect that your fertility specialist will know about this already, but these right here, which are non-cancerous growth known as fibroids. If you have a huge fibroid propelling through your uterine cavity, again, during the embryo transfer, that's going to get in the way and affect implantation. By the way, one of the things that a polyp will do is interfere with implantation. Ideally, your fertility specialist should already know that you have uterine fibroids. However, some of them may escape. They might not be identified during your preliminary ultrasound. During your mock trial, when a catheter is inserted and there is a blockage, we will know if you have a uterine fibroid that can interfere with implantation. So ladies, it's so important when you go for your next IVF cycle, don't sit there and just listen to the doctor and take in everything that he or she has to say and let them, run you like another one of those patients. Be proactive. positive about your next IVF cycle, ask about mock trials. Ask about whether that doctor can tell you why your other cycles have failed. Ask them about how they will tailor their protocol to suit you so that you have a better chance of having a successful cycle. Don't allow them to treat your case as just another case. You are special. Your situation is different. It varies, and not one size fits all. Watch that video. It's going to be really helpful, and it's hopefully, by God's grace, going to help you. Watch that video on my YouTube channel. It's going to be really helpful, and hopefully it's going to allow you to have the next IVF cycle that you go through be successful. Another thing that your doctor should be doing before you go for your next IVF cycle is to make sure that your endometrial lining, and so that's that thin lining, is thick enough. That lining needs to be ideally 7 millimeters thick before the inserted embryo will implant itself. So before you go for your next cycle, a good fertility specialist will get you to do an ultrasound and make sure that that lining is thick enough. If it's not thick enough, you may well be wasting your time. And there are drugs, there are medications that could be given to allow that endometrial lining to be thick before you go for your cycle. Watch that video. It's going to be really helpful. Hope that's helped. See you later.